everyone, it's Naturally Leisha and welcome back to my channel. If you are new here, welcome. If not, welcome back. How y'all doing today? I just wanted to let y'all know that y'all could press the red subscribe button, You're watching, you might as well press it. And then while you at it, press the bell button so you never miss another Naturally Leash upload. Like and share, comment too, because I like the interaction between y'all and me. But I'm here today to talk a little bit about my major, what it is that I'm studying, why did I choose to study it, and what it's like to be a medical laboratory scientist student. So if you're not interested, then you can leave. If you are, then stay put, grab a glass. I probably won't be that long, but yeah, grab a glass because glass of wine is very necessary. A glass of whatever you're drinking, whether it's white, dark, black, purple, whatever your preference is. But let's get into it. And I have my notes here, so if you see me looking down a little, that's what I'm looking at. What is a medical laboratory scientist? I get this question all the time. Usually when persons ask me what I'm studying or what I'm majoring and I let them know what I am doing, they always ask, well, what's that? So a medical laboratory scientist is a healthcare detective. Well, what I would consider a healthcare detective. We specialize in analyzing blood, bodily fluids, as well as diagnosis. So essentially, if we did not exist, your doctor would be guessing. Let that sit, let that marinate. Without us, your doctor would literally be guessing on what your diagnosis is, with your results, laboratory results are. Every test that you can possibly think of, whether it's a urine test, a feces test, a blood test, every test, a drug test or HIV test, every test, strep test, flu test, I can't stress enough, every test that you can possibly think of that you have taken in the past, it comes to us, me, medical laboratory scientists, to carry out and run the tests and the procedures to get your results back to give to the doctor to let you know what's going on with your health. Why did I choose this profession? I like science. I always had. I did it throughout high school. I did it in my first undergraduate degree. I've always had science. I've always loved science. I've always found it to be extremely, extremely interesting. And I always advise people to do what they find interesting and do what they enjoy and love, because when you do that, you're more inclined to learn. So if you are a person that finds science to be extremely boring, like a lot of people do, then this profession just might not be the one for you. Bars. Y'all heard that? Bars. I also love helping people. And I realize with this profession, I can play a vital role in patient care and a patient's health without having to interact with them. That right there, deal breaker for me. Because, not me messing up my hair, but that right there was a deal breaker for me. Oh my gosh, like if you know, you know. I just don't like the human-to-human interaction. I like to be in my own bubble, in my own zone, doing my own thing, and that's just that. So that definitely was a deal breaker for me. Another big factor for me was having a wide range of jobs or working environments that I could work in this field. Not only that you can work in like a hospital or a reference lab or a clinic, you can also do a forensic lab, a crime lab, a veterinarian clinic, pharmaceutical industries, research labs. So there are a lot of labs that you can work in this profession, and I felt that to be extremely important, because what if you get bored of working one place? You can always move to another place and work there, you know. Another big thing for me is I love to spend quality time with family and friends. I take that very serious. So working in a profession where I don't have to take work home was another deal breaker for me because it's very important to separate work life from home life. So obviously you have patients, HIPAA, that's when HIPAA comes into play, and being able to not have to take the work home, because obviously you have to deal with it's patients, you're dealing with, and then you work with machines and analyzers, and you can't bring those stuff home. So that was another big thing for me. I also had to take into consideration and ask myself if it was something that I could handle as it pertains to dealing with urine, feces, blood, bodily fluids, bacteria. A lot of people are very scornful or squirmish when it comes to those kinds of things. So I had to figure out for myself if it was something that I was okay with, which I was. Another thing was standing for long hours at a time, 8 to 12 hours. Sometimes you are just on your feet. And having already experienced that, it was something that was new to me, but having already experienced that in the lab during my clinicals, it's something that I was pretty okay with. Like the first week I was like, damn, my feet. But now I'm very adjusted or used to it. Another thing was the smell. Are you okay with the smell? Like certain smells make my head hurt or make me want to vomit. But so far, everything has been okay. The biggest reason that I chose to become a medical laboratory science was that because back home in the Bahamas, we do not have enough medical laboratory scientists. And because we do not have enough of them, it causes tests and lab results to be delayed for weeks, sometimes months. Something as simple as getting a pap smear done, which results may take like a week to come back, that takes weeks. So because they lack trained professional personnel in the field, I thought it was my duty to become one and go back home and be of help to my country. Realistically, people have died in situations like this because they didn't get their lab results in time, or they didn't get a diagnosis and there was no kind of or sort of treatment. Like, the urgency is there, but because there aren't trained professionals to do the work, that something like that happens, and it can occur. It has occurred numerous times. What's it like being a medical laboratory science student? It's definitely not an easy field. It takes true commitment. There's a lot of in-depth information, a lot of departments in itself within this field. You have microbiology, hematology, immunohematology, common name blood bank. You have clinical chem, you have urinalysis, you have serology. You have all of these different fields, phlebotomy as well as one of them. And each of those fields has its own information, and a lot of information at that. So it's definitely not easy. People look at this field and say, okay, it's a 2-year program, like that should be super easy, but it's not. For example, let me give clinical chem for example. We have to know each of those enzymes and why is those enzymes elevated in your blood results. Why are they decreased in your blood results? So those things allow us to know like what diseases or what this patient's diagnosis could be. For example, if your uric acid is elevated in your results, that could be a sign of gout. If your amylase is elevated, that could be a sign of pancreatitis. So if your AST or ALT is elevated, which they are liver enzymes, if that's elevated, that could be a sign of jaundice or liver disease. So it's just a lot of different factors that go into each department. Hematology, for example, that's when you do your complete blood count. So it tests for your white blood cells, your red blood cell, your platelets. That's how we know if a patient has sickle cell anemia based on how their red blood cell looks. They're called drepanocytes. So if you have a lot of drepanocytes in your blood sample, then you have sickle cell anemia. Blast, for example, if you have a lot of white blood cell, that's a blast, which is a white blood cell. If you have a lot of that in your blood, then that could be a sign of a cancer, leukemia, for example. Blood bank on its own is a whole world in itself, because that's a lot, you know, a lot of the different blood types. It's kind of like a life or death thing at blood bank. If you give the patient who is coming in for a critical surgery the wrong blood, that patient could die, you know. And these things happen all the time in a lab or in a hospital. Sometimes you have, which is the most common thing for the most common error in the laboratory is misnaming samples. You know, that's a big thing, and that's why, that's my other point that I come into play as a laboratory scientist. And as a student, I realized that you have to be good at troubleshooting. You have to be detail oriented. These are things you have to look for and look at, especially when it comes to mislabeling patient samples. And that's just having two different names on one tube. You know, ensuring that our results are accurate enough to give to the doctor or the nurse. It takes a lot of patience, dealing with the analyzers, a lot of patience dealing with the instruments. That in itself is like you become a mechanic in the lab. You have to be good at grasping things and making 2 + 2 equaling to 4. And I say that because you have to be good at problem solving. If you don't know how to problem solve, then this is definitely not a good field for you. You have to be good at working independently as well as a team, but mostly independently. Good at multitasking, because you'll be doing a number of things at once. I mean, you all over the place. And you also have to be good at communicating, because you communicate with doctors and nurses via telephone literally all day. So that's just some pros and cons, some things that I've experienced throughout my study as a medical laboratory science student. If you have any questions or interested in learning about anything else, let me know down in the comment section and I will make a separate video. If not, I'll just answer your question. But I hope that gives you some sort of insight into what I do and what the profession is about. We're definitely lab heroes. Actually, we're heroes, period. So put some respect on our name. Like I say, without us, your doctor would be guessing. But thank you guys for watching. Thank you for tuning in. Like, comment, share, and subscribe. The red button right there. Hit the bell too, so you never miss another Naturally Leash upload. Thank you all for watching, and I will see you in the next. Peace.